Good day, my dear foreign students, and topic of today's lecture, closed trauma of the chest, closed injuries of the chest. 30% of all causes of traumas with lethal outcomes belong to the injuries of the chest and its organs. You can see on this picture typical places of injuries on chest anatomical structures. First, rupture or possible trauma. First, rupture of trachea, a rupture of main bronchi. Third, rupture of lung tissue. Fourth, injury of the parietal pleura. 5 and 6, injury of the mediastinal pleura with development of emphysema of the soft tissue of trunk and neck. And 7, injury of the thoracic wall. Classification of the chest trauma. Injuries of the chest are divided into open and closed. Open injuries or wounds may be unpenetrating into the pleural cavity without damage of parietal pleura and penetrating with damage of parietal pleura. Penetrating wounds are always accompanied with pneumothorax, fit of air into pleural cavity, and hemothorax, accumulation of blood in the cavity of pleura. Closed injuries are met more often, are divided to the chest concussion, the chest contusion, which is subdivided into the with damage of chest bones and hemothorax or without it, with damage of chest organs and pneuma or hemothorax and hemipericardium or without it, and without damage of chest bones and organs. And large main groups: compression of chest organs, subdivided into the with damage of chest bones and hemothorax or without it, or with damage of chest organs and pneuma, hemothorax and hemipericardium or without it, and without damage of the chest bones and organs. You can see typical microscopic anatomy picture of hemopneumothorax. Possible source: abrupted fragments of the ribs. Concussion of the chest. Concussion of the chest occurs in the influence on the person of the aeroblast. Pathogenesis. In the result of strong irritation of the vagus and sympathetic nerves, a failure of the functions of cardiovascular and respiratory systems occurs. Clinical picture of the chest concussion. Typical groups of symptoms: breathlessness, paleness or cyanosis, cold sweat, reflex fall cardiac activity, and as a result, loss of consciousness. Treatment: bed regimen, warming, oxygenotherapy, cardiac drugs. The main group of closed injuries of the chest consists of the chest contusions. Clinical picture of the contusion of the chest soft tissues is manifested by the pains in zone of the contusion localization, occurrence here of the subcutaneous hemorrhages. In the case when contusion is accompanied with the fracture of the ribs, additional symptoms are added to the mentioned above picture, namely sharp pain and presence of crepitation symptom, impalpation of the areas of injury during movement and in the breathing in. On the X-ray picture, there are signs of the ribs fracture. You see first aid in chest contusion, tie bandage of the chest in fracture of the ribs. Treatment of the chest contusion without damage of internal organs. Bed regimen, analgesics, hemostatics, antibiotics to prevent pneumonia development, and intercostal novocaine blockades of the places of fracture. In chest contusion, very widely distributed intercostal novocaine blockade, especially in fracture of the ribs. In the most victims with closed chest trauma, the severity of condition and lethal outcomes are caused by cardiopulmonary disturbances, resultant to the injury of the structure and the failure of the heart and lungs functions. The most frequent cause of the cardiopulmonary disturbances are pneumothorax, which may be closed, open, or valvular, hemothorax, which may be small, less than 500 milliliters, moderate from 500 up to 1000 milliliters, and large, more than 1000 milliliter. Multiple comminuted fractures of ribs with formation of unfixed fragments, and heart contusions and hemipericarд with a growing heart tamponade. Pneumothorax, accumulation of air in the pleural cavity. Pneumothorax may be external, when air enters to the pleural cavity through the wound of the chest wall. It may be internal, when air enters the pleural cavity from lung wound in closed chest trauma. If the air entered into pleural cavity may go out through the lung wound or through the chest wound, it's considered to be the open pneumothorax. If air entered into pleural cavity in one time in injury and can't go out in breathing out, it's considered to be the closed pneumothorax. If the air volume which entered into the pleural cavity increases in every breathing in and doesn't go out in breathing out, pneumothorax is called tangent or valvular. The most dangerous are open pneumothorax, because a constant fluctuation of mediastinum leads to the development of pleuropulmonary shock, and especially valvular pneumothorax, because the growing shift of mediastinum results in the lung compression both on the injured and on the healthy side. Clinical picture and diagnosis of the closed pneumothorax. General condition of patient is satisfactory. If pneumothorax developed in the result of injury, the wound of the chest has a small size. In the wound circumference is determined swelling and crepitation during superficial palpation, signs of subcutaneous emphysema. Its closed pneumothorax formed due to blunt trauma, subcutaneous emphysema may be not revealed. In percussion, on the site of injury, tympanitis is determined. In auscultation, there is revealed a strong weakening of respiratory murmurs. In X-ray examination, they determine a degree of the lung collapse and shift of mediastinum to the healthy side. Typical view of victim with subcutaneous emphysema. Treatment of closed pneumothorax. In closed pneumothorax, the opening in lung or in the chest is being closed either by the clot of blood or by muscle shift in the nearest after injury time. Air in pleural cavity resolves independently. Only in serious disorders of breathing, one-time pleural puncture may be of need. It's performed in the second intercostal space along medial clavicular line. Clinical picture and diagnosis of the open pneumothorax. Injuries of chest with open pneumothorax have more severe cause. Besides the symptoms mentioned above, there is a pronounced breathlessness, cyanosis of skin integuments, and lung excitement. A victim takes a forced half-sitting position. In the chest, trauma is open. In the wound area, a murmur of entering and going out air is determined. There is pronounced emphysema. X-ray examination has the aim to clear up the lung collapse degree, presence of ribs fracture, and hemothorax. Scheme of development of an open pneumothorax. Paradoxic breathing in patients with open pneumothorax in view of ballotment or fluctuation of mediastinum. First position, breathing in. Second position, breathing out. Investigation of patient with suspicion on the open pneumothorax. Include palpation and hearing. Treatment of open pneumothorax. The first aid consists in the change of open into the closed pneumothorax by means of putting the occlusive bandage, if injury of the chest is cause of pneumothorax. In this case, processing of wound with suturing and blowout draining is necessary. Blowout draining is a variety of passive drainage, which has finger of the rubber glove, cut like a valve on the free end of it. This finger is put into antiseptic solution. First aid in open pneumothorax, occlusive bandage in open external pneumothorax. Wound surface is temporarily closed by soft rubber plate, first layer, and covered above plate the specific chest bandage with help of cotton rollers, second layer. X-ray view of open internal pneumothorax, left lung in state of collapse. Draining of left pleural cavity by below, subkinds of passive drainage. Passive drainage by below pattern schematically for evacuation of air and liquid. First A subtype of scheme. Scheme of draining, disposition of a tube in pleural cavity. Second scheme of passive valve. If open pneumothorax developed in the results of the chest closed trauma, an active drainage of pleural cavity is put. X-ray control of the draining function is carried out every 24 hours, every day. If on the third 24 hours lung has got smoothed out, thoracotomy with the lung wound suture and the draining of pleural cavity is performed. The same patient, state after left lung on the next day after draining of left pleural cavity by below Petrov. Air at the pleural cavity partially dissolves. Clinical picture of the valvular pneumothorax is characterized by the threatening to life disorders of breathing and blood circulation. General state of victim is extremely severe. Pronounced expiratory breathlessness, cyanosis of skin and mucous membranes. Motor activity, excitement exists. Injured person tries to hold his breathing in because breathing out compresses already compressed lungs. Scheme of investigation patient with suspicion of the valvular pneumothorax. Arterial pressure in case of valvular pneumothorax decreases. Pulse is rapid and weak. There is sharply pronounced subcutaneous emphysema. X-ray film reveals a total collapse of the lung on site of trauma, a sharp shift of the mediastinum to the healthy side, and narrowing of the lung field on the healthy side. Scheme of movement in pleural cavity in case of internal valvular pneumothorax. Paradoxic breathing. External valvular pneumothorax. Scheme of movement in internal organs in thoracic cavity. Nota bene, in the injury of trachea and main bronchi, a development of rapidly growing emphysema that compresses heart and large vessels is possible. In this case, a severe breathlessness, cyanosis, overfilling of the neck veins and upper extremities is revealed. There is widening of mediastinum shadow and accumulation of air in it on the X-ray picture. Treatment of valvular pneumothorax. Treatment of valvular pneumothorax starts from its temporal change into open by means of pleural puncture with a thick needle. Furthermore, pleural drainage is applied. Active draining with creating permanent negative pressure is preferable. If valvular pneumothorax doesn't solve on the third 24 hours, thoracotomy with lung wound suturing is performed. In mediastinal emphysema, neck mediastinotomy as an urgent draining operation is performed. Furthermore, thoracotomy is performed to remove rupture of bronchus and trachea. First stating valvular pneumothorax, puncture of pleural cavity with remaining of open needle. Clinical picture and diagnosis of hemothorax. Weakness, breathlessness, chest pains and cough. Paleness of skin, decreases of arterial pressure, rapid pulse, dullness of percussion sound over the chest lower portion on the site of injury. In X-ray picture of the pleural cavity, a shadow of fluid with oblique level is revealed. In combination of hemopneumothorax with horizontal level. Final diagnosis is made in the pleural puncture, usually performed in second or in 6th, 7th intercostal space on the back axillary line. You see oblique level of a fluid shadow, it means blood, in hemothorax without pneumo component. Depending on the amount of purine blood, they distinguish small hemothorax blood amount doesn't exceed 500 milliliters. On X-ray film, accumulation of blood takes level below scapular angle. Middle hemothorax amount of blood from 500-600 up to 1000 milliliter. On X-ray picture, accumulation of blood exceeds the level of scapular angle and may reach cervical pleura. And large hemothorax amount of blood exceeds more than 1 liter. On X-ray picture, accumulation of blood exceeds the level of scapular angle more and more, and obligatory touch to the cervical pleura. Hemothorax may exist with cyst of or continual bleeding. Rouleau-Grégoire's test helps answer the question where the bleeding has stopped or proceeding. If blood got in the pleural puncture, has coagulated in serge, the bleeding proceeds. If blood got in pleural puncture lost the ability to coagulate, it indicates to the cease of bleeding. Treatment of hemothorax. Blood from pleural cavity should be removed as soon as possible in order more quicks getting smooth out of the collapsed lung. Small and middle hemothorax may be liquidated with help of pleural cavity draining. In cases of large hemothorax, with the aim to stop internal bleeding, as well in case of revealing large foreign body, thoracotomy is administered obligatory. You see typical places for thoracic puncture. Monopolar with puncture in 6th intercostal space, and bipolar with one in the same time puncture in 2nd intercostal space for evacuation of air blast, and to the 6th or 7th intercostal space for evacuation of liquid component. Multiple fracture of ribs. Dangerous for life disorders of external respiration occur not only in pneumo and hemothorax, but also in multiple fracture of ribs without damage of inner organs. Fracture of 6 and more ribs and on one side, especially double, so-called fenestrated, have the most severe cause. In the last case, costal valves form and paradoxical respiration with retraction of injured section on the chest in breathing in occurs. Shock clinics develops its of need to carry on anti-shock therapy. Scheme of suffering patient in case of multiple fracture of ribs at physiological shifts. In multiple fracture of ribs formates like window fracture with subsequent shifts of the free part of chest and mediastinum in breathing in. Left illustration in breathe in, paradoxical breathing, second part of drawing in breathing out movement with high amplitude of ballotment and irritation of internal organs and large nervous components. Treatment of multiple fracture of ribs. In fracture of ribs multiple, they perform Novocaine blockade of fracture places or paravertebral blockade. In multiple fracture of the ribs, it's of necessity to perform a cervical vagosympathetic blockade by Vishnevsky. Having revealed symptoms of paradoxical breathing, it's of necessary to perform fixation of flotating portion with the help of special plastic splint by means of sewing to the chest tissues, minimal to the 2, 3, up to 4 weeks. The second mean of fixation, traction by the load through the block with the help of ballet forceps, fastened on the ribs in the center of mobile chest portion. For with hypoxia, inhalation of oxygen is carried on. To free bronchi from the clots of mucus and blood sanation of bronchi through bronchoscope is performed. In progressing respiratory insufficiency, artificial lung ventilation is carried on. Heart contusion. Clinical picture of heart contusion. Paleness, adenomia, falling of arterial pressure, weakening, and becoming more rapid or more slow pulse, similar to myocardium infarction on electrocardiogram. Threatening to life condition develops in the hemorrhage in the pericard cavity. In this case, the heart may stop because of the tamponade development of hemipericarд. By X-ray, we can see widening of mediastinum shadow in the upper 1/3. Typical view of hemipericarд with enlargement of hemipericard shadow. Exfusion of blood into pericardiac sac or hemorrhage into the pericardiac cavity. We can see this situation as hemipericard, possible complication of the heart contusion. Treatment of hemipericard only surgical. Operation consists of pericardial or thoracotomy, pericardiotomy, evacuation of fluid blood, and stop of bleeding. Nota bene, operation is completed by the applying rare suture on pericard and its draining. Compression of the chest. Etiopathogenesis. Compression of the chest occurs in action of the chest of two solid bodies in opposite direction by carriage buffer in the result of landslide. Due to the compression, intrathoracic pressure suddenly increases. Blood from the pleural cavity vessels moves into caval vein, vena cava superior, veins of head and neck. The state of traumatic asphyxia develops. Clinical picture of compression. Complaints of chest pains, breathlessness, weakness. Punctate hemorrhages occur in the skin of the head, neck, upper portion of the chest, smooth mucous membrane, and scleros. Treatment is symptomatic. Rest, vagosympathetic blockade, narcotic analgesics, cardiac drugs. In the damage of ribs and lung tissues, treatment as described in the proper parts is carried on. You can see vagosympathetic blockade by Vishnevsky in patient with severe thoracic trauma. Thoracotomy. Searching of bleeding, damaged bleeding, and damaged part of lung. Moment of searching. Suture of the damaged lung. This all information today. Thanks for your attention. Good luck.